Hi, my name is Candy. I'm from Canada. I have seen the good surgeries and the bad surgeries on the internet, such as YouTube. If you Google any procedure going wrong, you will find disaster stories with all surgeries, unfortunately. Most people that have had bad results tend to post their negative experience, which would make one assume the surgery is risky for most. But it's because happy patients tend to go on with their lives and new eye color and not post on the internet. It's important to research the doctor you select and speak to many of the doctor's past patients. One should not choose a location out of convenience because it's closer to your country. There were facilities I could have chosen closer to where I live, but there were no video reviews or patients I could contact that went to that doctor, so I preferred to travel further away, which would guarantee me a higher chance of success. One thing I learned from watching videos on the internet is if you have side effects, increased eye pressure, red eyes, light sensitivity, cell count reduction for a prolonged period of time, one should not wait for 1 or 2 years to remove your lenses, but follow what Brightocular advises. If one checks their endothelial cell count regularly, implants could be removed early on if they notice a trend of cells counting reducing, rather than waiting until the cell count further reduces, requiring them to undergo a corneal transplant. These issues can usually be avoided with proper follow-up and taking actions early on at the first hint of issues. I can understand how people fall in love with their new colored eyes. It becomes part of who they are, but they should not compromise their vision by going against his or her doctor or Brightocular when advised to remove. I have even spoken to patients that have had it removed, but earlier on making a full recovery because they did not wait. It is in Brightocular's interest and the doctor's interest for patients to remove immediately if there is an issue, as they do not want anyone to suffer from permanent damage. All risks are stated on the patient consent form patients sign, with doctors, glaucoma, corneal decompensation, iris atrophy, red eyes, and so on. This is your eyes, and Brightocular takes it seriously that patients know the pros and cons when undergoing artificial iris surgery. I love my new eyes. Thanks.